This is Marie. She just got healthcare coverage through her job. She could have also applied for state-run health insurance if she didn't have enough money or her job didn't provide health benefits. Now that Marie is covered, she can start getting healthcare. Her friends have talked about several local places to get care, but she isn't sure how to get an appointment. Marie could go to the medical center and ask, but she doesn't have a car, and it's a very long walk away. She can find the phone number on the internet and call them. There's just one problem. Marie doesn't speak English. That's okay. Local medical centers have interpreter services. Before she calls the medical center, Marie's daughter comes home and tells her she needs a sports physical to be on the track team. Marie doesn't know what this means, but the helpful staff at the medical center explain. Sports physicals are to check on students and make sure they are healthy enough to participate in sports. The receptionist is able to help schedule her daughter's appointment on the same day as hers, so she only needs to take one trip. Before she hangs up, the receptionist reminds Marie to arrive 15 minutes early because Marie needs to fill out some important paperwork before her appointment. Also, she needs to bring her insurance card and identification. Otherwise, the office can't get paid and she may get a bill. Marie asks if her daughter can interpret for her. The receptionist says she needs to have a certified medical interpreter because even if her daughter can speak very good English, she may not know all of the words the doctor is using. Interpreters are offered free of cost. Interpreter services may be provided by in-house interpreters, phone interpreters, or video remote interpreters depending on the language needs of the patient. Now that she's called and made her appointment, it's important for her to write a note with the date and time and put the note in a place that she will remember. It's the day of her appointment, and Marie is glad she arrived early because there's so much to do. Marie brought her insurance card, and the office staff take her information down and make a copy of her card. Then, the receptionist gives her forms to fill out for her daughter and her. There are a lot of questions she must answer, all written in English. Even though the office staff is very helpful, she is glad to have the interpreter there helping her. A nurse calls them into the office. She asks how Marie and her daughter are feeling and writes down notes for the doctor. She also takes notes for the daughter's sports physical. The nurse writes everything down. This helps the doctor make sure he or she doesn't miss something. The nurse leaves once she has taken down all of their information. When the doctor arrives, she greets them with a smile. She introduces herself as Dr. Lindsay. She starts with the daughter's sports physical. Dr. Lindsay checks her eyes and ears, breathing, strength, and balance. She asks a few questions about their family's health history and if any conditions run in the family. Afterward, the doctor says her daughter looks healthy and gives her the go-ahead to run track. Now it's Marie's turn. Dr. Lindsay asks her many questions. Some questions are very personal. Marie doesn't even talk with her closest friends about some of these topics. Marie asks why the doctor is asking all this. Dr. Lindsay explains that there are people in almost every community who look completely fine, but who could be hiding something very important they need to share. This could be anything from an embarrassing health concern, like a hard lump in someone's breast, to feeling sad all the time, to being in an abusive relationship. There are even people who are held prisoner, and the only time they are set free is to go to the doctor. At the medical centers, there are experts whose only job is to deal with these kinds of situations and help patients who may need it. Sometimes they are someone's only way of getting out of a dangerous situation. Marie says she doesn't have anything like that to worry about. Dr. Lindsay says that's good, but she still has to ask all new patients these questions. After a short physical examination, Dr. Lindsay tells Marie she'd like to do a breast and pelvic exam. She asks Marie if she has ever had a pap smear or knows what that is. Marie says she doesn't. Dr. Lindsay says a pap smear is to test for cervical cancer. She tells her how it would work. With Marie lying flat on the exam table, Dr. Lindsay would use an instrument called a speculum to open her vagina so she could see inside. Then she'd use a brush to collect cells from her cervix, which is the opening to the uterus which holds the baby during pregnancy. Then she'd put the brush into a bag to be tested later. The doctor warns Marie it could feel a little uncomfortable and may cause some cramping, but that it will pass. Dr. Lindsay says it's a very important test because they can see any signs of the cells becoming abnormal and intervene before they become cancerous. She says the test is very fast. Marie decides some discomfort and embarrassment are worth not getting cancer, so she agrees to do the test. Looking over her notes after the exam, Dr. Lindsay notices Marie has been feeling sick in the morning lately and asks if she might be pregnant. Marie says she could be. Dr. Lindsay says it's easy to check with a urine or blood test. She'll have a lab tech draw her blood, and she'll call Marie when she gets the results. Dr. Lindsay says goodbye, and then Marie has her blood drawn. She's a little afraid of needles, but the lab tech makes her feel at ease, and she hardly feels a thing. A few days later, Dr. Lindsay calls with Marie's blood test results. It turns out that Marie is pregnant. The office would like her to come in for an initial prenatal visit to make sure Marie and her new baby have all the best care. Dr. Lindsay walks in and congratulates Marie. She tells her about the tests they like to do early in pregnancy to screen for any risks to mother and baby. The doctor also says she'd like Marie to take prenatal vitamins so her baby has all it needs to develop properly. She says Marie can get the vitamins at a local pharmacy. She asks if she's ever been to the pharmacy. Marie says no, but she knows where it is. Marie lives close to the pharmacy, so she walks there. One of the pharmacists speaks her language, but if they didn't, she could have asked for an interpreter. She goes up to the desk and hands the clerk her prescription. He hands her an intake form to fill out, so they'll have her information in the system. Then he goes out with her to get the vitamins she needs. He picks them out, and they head back to the desk. She gives him her insurance card so the vitamins won't cost too much. She pays for the vitamins, and then the clerk sends her to the consultation desk, where a pharmacist meets her to tell her how to take her prescription. He also explains that before the bottle gets completely empty, Marie needs to bring it back to the pharmacy to get it filled again, which is called a refill. She has to have it refilled at the pharmacy, not the doctor's office. The doctor doesn't have any medicine to give her. The doctor only writes the prescription, which tells the pharmacy what to give her. Marie's dad hasn't been feeling well. He doesn't think he needs a doctor, but Marie is worried. She wants to make sure he stays healthy so he can watch his grandkids grow up. Now that she is familiar with the healthcare system, Marie decides to help her father get an appointment. She calls the medical center, gets an interpreter for the scheduled time, and reassures her father that he is taking care of the people he loves when he is taking care of himself. When Marie's dad comes out of the office, he has a pack of test cards. The interpreter tells Marie the test cards are for checking his stool for signs of cancer. It sounds strange, but the interpreter explains how important the doctor said it is to do this test, because he could have cancer without knowing it. She says the earlier they catch cancer, the easier it is to treat. The interpreter walks Marie and her dad through what he's supposed to do. Reluctantly, her dad does the test and mails it in. The test comes back, and it shows blood in his stool. They think he might have cancer. They want to do more tests. If they catch it soon, he should be okay, but they need to act right away. The doctors perform a colonoscopy and find a tumor. Luckily, they are able to perform surgery and remove it before the cancer can get worse. It's easy for cancer to go unnoticed. That's why these tests are so important. Marie's dad is glad he did the test. It seems silly at the time, but now he has many more healthy years to spend enjoying his grandchildren. Nice work, Marie. You have quite the handle on our healthcare system. Just remember, we are here to help you. So please ask questions and trust us. We want to help you stay healthy.